everyone, Cheyenne. I'm a student here at the College of Nursing, and today we'll be performing the IV insertion. First, I just want to note that my printer was not working, so this is just a random piece of paper I got out of my drawer, but it has Jaguar Jones written on it, and then I had to make the armband. Okay, so first I'm going to start off by verifying my orders and checking my hospital policy. Okay. And now I'm going to gather my equipment. So I'm going to turn my camera down now. Okay. So gather my equipment. So now I'm going to perform hand hygiene and identify my patient using two identifiers. So we have Jaguar Jones, MR number is 417-6352, 417-6325. 417-6352, and they are allergic to penicillin. Okay, and this is my sharps container. Okay. All right, so now after doing that, I'm going to pull the curtain for privacy and explain the procedure to my patient. Privacy, now I'm going to move the trash can, perform hand hygiene, and don my goggles. Okay, so now I'm going to raise my patients to the bed, lower their side rails, and put a towel under them, place them in a comfortable position, either supine or sitting up. Have a towel under them. So now I'm going to open up all my packages. Okay. Now, after opening my packages, I'm going to get my alcohol prep, clean the insertion cap on the J-loop, move that away, take the cap off to my saline, and I'm going to insert the lower lock, undo the lid to it, make sure it's unclamped, and I'm going to prime it into the trash can. Okay, so it's primed. Place the lid back on just slightly and place it back into its container. If it would have touched anything, it got contaminated, I would have started over again. So now we're going to remove the IV from its package, take the Tegaderm out of its packaging. Okay, so now I'm going to demonstrate or verbalize how I would choose a vein. So we would go to the most distal site as possible, try the non-dominant arm if possible, and we would find a large spongy vein. Okay, so now I'm going to place the tourniquet 4 to 6 inches above the IV site. I'm going to assess for a pulse and assess the vein. Okay, so now I'm going to perform hand hygiene again, don my gloves, and I'm going to cleanse the area with chlorhexidine prep. Okay, I'll be sure not to touch it. I'll put that in my trash can, make sure I don't touch it, and let it dry for about 30 seconds. Okay, so now that it is dry, I'm going to remove the cap to my needle. I'm going to anchor about 2 inches below the vein that I'm going to do. Make sure I do not touch the area that I cleansed. Make sure that my IV does not touch the area that I cleansed. I'm going to instruct my patient that they will need to be still and feel a light stick. So we're going to go bevel up 10 to 30 degrees. Okay. I'm going to insert till I see blood return. So I see blood return, so I'm going to lower my needle and insert about another 1/4 of an inch. Okay, so now I'm going to advance the catheter, but not the needle. I'm going to advance it to the hub head skin. Now I'm going to stabilize it, pop the tourniquet, hold pressure, and remove the needle, place it into the sharps container. So now I'm going to get my J-loop, remove the cap, twist it on, and I'm going to temporarily secure it. So now it's temporarily secured. I'm going to aspirate. Okay, and now I'm going to flush the vein. So I'm observing for any swelling or anything. I do not note any swelling, so I'm going to disconnect it and place this in my sharps container as well. So now we're going to get the tegaderm. We're going to place it, not covering the hub, making sure we don't cover the hub. Move it out. Okay. Now we are going to get our tape, remove the temporary tape, and have the J-loop go back to its normal position and tape it. Okay, so now the tape is secured. I'm going to clean up my area. Clean up my area, remove my gloves. Now I'm going to write the date, time, and gauge and initials on my label. So it's a 20 gauge. The date is 11/16. It's 10/30. And CK for my initials. Now we are going to place that at the top of the IV. We're not going to cover anything. Make sure that it's still visible. So now that it is dated and labeled, I'm going to instruct my patient on how to not dislodge the IV. I'm also going to instruct my patients the signs and symptoms of IV complications, so anything like infiltration or inflammation. So I'm just going to tell them that if they see any fluid seeping around or blood seeping through their transparent dressing, if they have any pain, see any redness or swelling, to notify me, but I will also be going in there and checking it regularly. So I'm going to lower my patient's bed. I'm going to remove the towel out from under their arm, lower their bed, raise their side rails. I'm going to perform hand hygiene, give them the call light, and I'm going to remove my goggles, perform hand hygiene again, and then I'm going to go document. So I'm going to document the date, time, location of the site, how many attempts it took me to put the IV in, how my patient tolerated it, the gauge and length of the needle. We're going to document how they took it, and I'm going to document the flow rate, or if it was a saline lock or flow rate, if there was fluids prescribed. Okay. So now I'm going to demonstrate how to remove the IV. So first I'm going to check my orders, make sure I'm okay to remove it. Put on my goggles. Hand hygiene, I'm going to get my gloves. We have my 4x4s right here. Our 4x4s, and my tape is right there. So first I'm going to start off by removing this tape. Okay. Now while folding it, I'm going to start from outwards. Now that I have it pulled up some, I'm going to get my gauze. Place my gauze right here at the insertion site, and I'm going to swiftly remove it parallel to the skin. Check for intactness. I'm going to dispose of it into the sharps container. So I'm going to check the site for any drainage, redness, swelling, infection, anything like that, pain or tenderness. I don't see any, so now we're going to fold the gauze up, hold pressure. And place tape around it. I'm going to lower my patient's bed back down to the lowest position, raise their side rails, give them their call light. There we go. Remove my gloves, my goggles, hand hygiene, and done.